situation with Mercyhurst University students. Information was released by the university late yesterday. This particular case is being handled by the state of New York, the students' home state. Mercyhurst has informed us they have provided guidance to students still on campus today, as well as to their faculty and their staff. Based on recent guidelines from the Pennsylvania Department of Health and the complexity of this particular situation, any student left on campus is required to self-quarantine on campus until Saturday, March 21st. Having said that, we now have some additional community information to share. This morning, we received confirmation of our first COVID-19 case in Erie County. This individual is a 35-year-old who traveled while within the United States, and we do not believe that this infection came from local community spread. Our excellent Erie County staff continues to work through this situation, and I assure you that we have a team of experts absolutely capable of handling the current situation. We will continue to communicate new information to the community as it becomes available to us. I now invite Melissa Lyon, the Director of Erie County Department of Health, to provide an update.
Thank you, Kathy, and thank you all for being here in this important time. This is a time that I want to stress the importance of everyone staying home if you are able to. As you can see, no one, no matter how old or how young or how healthy, is immune from this travesty. I encourage you to enjoy this time with your family and take care of yourself. Be responsible citizens. Think about each other. These are important times that we must follow the direction of public health officials to protect one another and those that we love. There is no longer a looming threat. It has arrived in our county. If you are receiving mental health services, please continue to do so. Most offices are transitioning to video and telephone-based services to keep clients safe and healthy. 211 can assist you in finding services. If you or someone you care about are feeling overwhelmed with emotions like sadness, depression, or anxiety, or feel that you want to harm yourself or others, call 911 or SAMHSA's Disaster Distress Helpline at 1-800-985-5990. That's 1-800-985-5990, or text Talk With Us at Talk With Us at 66746. Again, text Talk With Us 66746. The Erie County Department of Health and the great staff that we have working here each and every day will continue to conduct interviews and follow-ups to contain the spread of disease. The community mitigation measures that we put into place earlier this week will absolutely help the spread of disease. We are asking everyone that's listening, everyone that's here, everyone that sees this post, we need you to be compliant with our recommendations and the requirements from the Erie County Department of Health, our public health officials, so that we can slow the spread of COVID-19, and we need to flatten the curve. I thank you all for being here. I know these are difficult times. I'd like to return it back over to Kathy.
And before I turn it over for questions, I would like to again thank the people of Erie County, the businesses of Erie County, for doing their part, because we can only control the spread of this virus if we as a community continue to come together and fight what we know is inevitable, that we would have the virus here, to fight that spread of the virus throughout our community. I cannot say enough about the people of this community and the businesses and all that they are doing to help us here on the front lines. So with that, I'm going to open it up for some questions, and I'll ask the media to please ask questions generally, because I think many of the questions are what you all want to know about.
Kathy, the 35-year-old, do we know? Can you say if the person's in the hospital, if the man's in the hospital, or is he self isolated?
I'm going to have Shar Behringer speak about the question was, can we speak more to the 35-year-old who has been diagnosed?
This particular person, fortunately, is not ill enough to require hospitalization, so this person is confined to their home.
Where did they travel? You said they traveled in the United States. Were they in a hot spot? And what other exposures might they have here in the Erie area before they knew they tested positive?
Okay. The question is, where did this person travel? Where might they have picked up the disease? At this point, we know that there was travel in an area that did have disease at that time. We know that there were limited exposures within Erie County. Those persons are being identified and contacted by our staff here at the health department.
Are you willing to say what state, what area the person was traveling in?
Not at this time, no.
What about the Mercyhurst students, the Mercyhurst contacts? How many students are being required to quarantine on campus there, and have those students been tested here in Erie County?
I have to defer Mercyhurst questions to Mercyhurst University.
They're deferring to you.
Okay, we do not have that information.
Do you know how long the 35-year-old was in Erie County before getting tested?
He's a resident of Erie County. I don't have that test date off the top of my head.
Is there anything other people should know about contact? You said limited contact, but can you tell us, does the person work in Erie County? Had they returned to their workplace from their travel? Are there any other areas that you would like to encourage people to come in and get testing because they may have contact with this person, or flights that they may have been on with this person?
Okay, as far as contacts go, the health department at this point will be talking with anyone who is identified as a close contact. If you are not contacted by us, we do not have any reason to believe that you are at risk of contracting the virus that causes COVID-19 from this particular incident.
We know that St. Vincent today, hi Mark, has set up a drive-through testing site. They say it's not active yet, but it will be soon. What do you know about when that will be active, and will there be other similar sites in the county?
Okay.
Thursday's panel.
Okay, we're going to have to, the question was, how soon will the off-site testing be available through some of our community partners, such as the hospitals? At this point, we have to defer that to the hospitals. They're working on their timelines as fast as they can. We don't have solid information on that. The hospitals would be best able to answer that.
Shar, with the tests being so limited, what was this person symptomatic? Did he go to primary care and then get the test at primary care? What was the workflow on the testing for this positive case?
Yeah. So, I mean, I'll be honest, I think at this point you're going to need to trust the public health professionals that we really did follow the appropriate protocol on whether this individual met testing requirements, whether they were symptomatic, and when that test occurred and how that sample was collected really adds no additional value to what we know and the direction we'll be going as we move forward.
It's just in the context of the limitations of the testing right now. We're just trying to figure out if the people that need the testing are able to get tested.
So I can answer you that as of now, those that we identify that require testing per the algorithm that we follow are getting that testing. The widespread testing is yet to be determined.
After you identify that they need testing, do they still have to go through a step where they're getting online in a queue with state officials? Because we know of an example of a person who traveled in Mexico who was number 96 in a queue with the state yesterday waiting to find out if he should be tested.
From a county health department perspective, we have now been empowered to assign our own case numbers. We do not have to get approval from the state health department for those who meet the criteria for testing.
So, and I would love to follow up with the value of having a freestanding public health department. There are only 10 in the Commonwealth. And so with that brings the value that you have excellent professional staff that know the algorithm, and we're given a lot of trust to make these decisions without having to go into queue through the Pennsylvania Department of Health.
Just out of curiosity, was the Mercyhurst student tested here before going home to quarantine? And how do you decide whether a case is counted here or there? Is it where they are once a diagnosis is positive?
It's for the residents, right?
Diseases are counted by the residents of the person who has been confirmed.
So was that student tested here and then went home?
Student was tested at home.
Shar or Melissa, who was doing the contact investigations for that student? Is that New York State or is that Erie County?
Because it is a New York State case, they are responsible for the contact investigation. Certainly Mercyhurst University and the officials at Mercyhurst University are intimately involved with that process.
But would you be intimately involved too, because then they may require testing here in our county?
Okay, at this point, Mercyhurst is handling that.
To follow Shar, I mean, it's just a complex scenario that it's not an easy question to answer at this point.
Are you concerned about it because it's happening here in our county, even though it's kind of contained on their campus? And do you have an idea of how many students might be impacted?
Again, the Mercyhurst case is being handled primarily by Mercyhurst. We will partner with them closely. I think to answer your question more broadly, the concern of COVID-19 disease throughout our nation should be a concern of everyone, which is really the message I want to be delivered, is how important it is that everyone follow what our guidances are about staying safe, staying healthy, staying socially distanced, staying home if you can. The message cannot be repeated enough at this point.
I think because a period of time went by from March 10th when the student went home until now, and there are faculty members, stores and bars and restaurants where, you know, contacts might have been made with the rest of us who do live here. I think that's why we're asking these questions.
Would you say that you're confident that community spread is happening, but just not detected yet?
I wouldn't say that I'm confident the community spread is happening in Erie County. We need to know more about where the disease is throughout our entire community before we could ever make those types of statements. And it's a difficult time right now to be staying ahead of the information that's coming to us in a way where we can make the most appropriate decisions for everyone involved.
Melissa, is there any timetable where there'll be enough test kits to get beyond this protocol testing, and how soon that might be?
I think I had said I'm very hopeful that test kits become available as fast and as rapidly as the government can make them available, but there's so many unknowns. The other thing I can share, and it might be helpful, is we get information 24/7. We don't wait till the next morning to get that information. So when that information becomes available to us, we're processing it and making decisions early the next morning and all throughout the day, if that's at all helpful.
A lot of people are worriers, and they may think they have the symptoms just because they're thinking about this so much, and there have been a lot of negative tests across the state as well. So can you speak to that a little bit, helping people know really what the clearest signs are with your current information, whether they should even be asking you if they can be tested?
I'm going to defer that one to Shar. Her and her team answer this question multiple times a day.
We know at this point of time in Erie County, we still have significant flu disease out there. The most important thing that people can do if they are ill is stay home. If they are so ill that they feel like they need medical attention, then they need to talk to their primary care provider, and that decision would be made at that point. Because we don't have enough test kits at this point, the basic message is, if you are ill, stay home. Stay home until the symptoms are cleared. Stay home until the fever is gone for at least 48 to 72 hours.
I have one more. I mean, a lot of us have elderly parents, fragile and frail parents that we visit or check in on from time to time. So if you've traveled even domestically, how long should you wait before you see them? I mean, what should we do about those folks that we really are concerned if they might be exposed?
As far as our contact with the older residents of our community, there's a reason that we're talking social distancing, quite frankly. That's going to be the best protection. If you're concerned that maybe you were exposed, that you might unknowingly be carrying it, then your answer is the social distancing.
I guess, are you able to disclose if the person is like a resident within the city of Erie or is it outside?
We are not going to go into that level of detail.
And then, is it a male, female?
We are not going to go into that detail.
Do you know about how many people, I guess, potentially could have come into contact or how many people are being tested?
That information is still being gathered.
When do you expect to have an answer for it?
Even when we have it, we will probably not release that. That's part of a disease investigation that is not relevant to the process.
Shar, did you report this case yet to the governor? Is it on the state map?
The state map actually does not get updated in real time. It may not show up on the state map until noon tomorrow.
With the case being official in Erie County, is there any change in the county protocol, or is it based because of the declaration a couple days ago? Are we still, is anything changed because there's an official case now in terms of any protocols, health department or countywide?
Protocols change as they come in from the CDC and from the Pennsylvania Department of Health. They're not changing based on our confirmed case. The state is certainly aware of our confirmed case. It just won't get up on the website.
Shar, this may seem silly, but how are you guys all doing? I mean, we're all worrying, but you're dealing with this on the front line every day. How's the health department staff hanging in there? And are you calling in any reserves or extra people to help you deal with what you're dealing with?
Okay, thank you for that question, Lisa. That's very considerate of you. As far as the health department staff, we're doing lots of pep talks. We're recognizing the superb work that everyone is doing. We're repeating and repeating. This is core public health. This is what we do. It is trying. We're encouraging staff, take your breaks, take your meal breaks, talk to each other. This is what we do. We have called in extra staff as available, and we will continue to do so if things expand.
And I was just going to add one thing. The community's been very kind to us in recognizing our efforts. Treats are dropped off from time to time to help us through it, and we're also looking at bringing in therapy dogs just to give us a little break and recharge our battery in a different way.
And then, I have a question. So, I guess, how will this impact the non-essential shutdown businesses? Will that be extended, or is that not?
At this time, we are still saying that the non-essential businesses need to stay shut down until next Friday, the 29th of March. Of course, as we've seen throughout these last few days, recommendations and restrictions can extend, they can change. We say, things are changing often on an hourly basis, certainly on a daily basis. So at this point, we haven't changed any of our recommendations in terms of the closure of non-essential businesses. Again, I will say we've had businesses who maybe originally didn't shut down, but now they are shutting down. They're finding innovative ways to get their product out to people in our community, and I really appreciate all that they are doing, because we know that this is obviously very, very difficult on our businesses. We know that this is even more difficult on our citizens who maybe don't have a paycheck anymore. And we have our social service agencies and our philanthropic community really stepping up. We've had conversations with numerous groups in that arena who want to see how they can be helpful to those who are going to suffer through this most, and especially when it comes to the financial side or not being able to get the resources they need. So again, the community is coming together in ways that I think are unprecedented, and that says a lot about our community as a whole.
What are you doing about businesses who are refusing to shut down? How's the county handling that? And then what's the latest information you're getting from the state?
So our environmental division here at the health department is out monitoring the situation, most particularly when it comes to bars and restaurants, which are mandated actually to shut down any in-house eating or drinking. And so we hold the licenses for those businesses, and we could revoke those licenses if need be, but we hope it doesn't get to that point, and if we're finding that they are cooperative. And we are following up on any community member that might call here and have a question or concern about a business that is staying open. So we're following through on that, and we haven't gotten any further directive from the state except the most recent that's all on the state website in terms of the recommendations on which businesses can stay open, which ones they urge to shut down, other than the bars and restaurants, which are supposed to shut down in terms of people congregating.
Any protocol for businesses to make that decision? I know, like the Historical Society, they understood that they should close to visitors to the museum, but should their staff still be working? How do people arrive at those decisions if it's not spelled out?
So we ask businesses to use their common sense and know that we are trying to keep people socially distant from each other. In county government, we have now sent home all non-essential employees, and we told them you are not to work, you're not to come to work, you are to stay home, and we will let you know when you're coming back. This is at least through next Friday. Obviously, in government, and especially with the work that we are doing here, we have a number of essential employees. You see many of our health department staff here. They're working diligently on this issue, as obviously the 911 call center and the prison and even the Department of Human Services. There are certain services that we cannot shut down, and we will not. So we ask businesses to use their best judgment, understanding how important it is that we all come together to make this happen.
Do you have an estimate for the number of non-essential county employees who have been sent home?
I don't know what the number of employees from the county that are non-essential that have been sent home, but if you want to reach out to Gary Lee or Sabrina Fisher, they could probably give you that number.
Okay.
So one last question, anyone? Lastly, I want to remind the media about tomorrow, 1 o'clock. That is a press conference that was set up so that you can hear not only from us here in county government, but you can also hear from our leaders in our medical facilities. As you know, we have UPMC Hammett, St. Vincent's Allegheny Health Network, LECOM, Mill Creek Community Hospital, and Corey, and Meadville Medical Center. And I'm going to say one last thing about our health department. I have had numerous commissioners contact me from those counties who do not have health departments. We are so lucky and blessed to have this health department here, and 57 counties do not. So we have been trying to lend our expertise and our knowledge to them as possible, and obviously our neighbors closest to us, Crawford County, we want to include that hospital and in this press conference, and we include them in many conversations. So thank you to all. We appreciate you getting the word out to our citizens about what is happening in our community, and again, we want to stay in touch with you as any news continues to evolve. Thank you.